They need to understand how much toothpaste to use, how to brush the teeth, when to floss. These are all questions that need answers to. And it's not something commonly available. It's not something your primary care physician would usually talk to you about. There's a misconception. Primary care physicians very often would say the first time a child should go see the dentist is at age 3. That is no longer the case. And unfortunately, our profession can't do as much, or should be doing more, in terms of promoting this concept of first visit at 6 months to a visit. So that's one of the messages I want to bring out to you. Why is oral hygiene important for kids? Well, they're going through something called growth and development. So a lot of parents, we would hear, even from our generation, that if you don't lose a baby tooth, it's just a baby tooth. I mean, what's going to happen? Well, those baby teeth, they're in your mouth to try to keep the space free. When you lose the space prematurely, growth and development does not occur in the natural process. You end up getting deficiencies. The jaw doesn't develop accordingly. The facial proportions don't develop accordingly. And this is one of the leading causes to kids missing school, because they have dental trauma and they have dental disease that are not treated. So it is documented that a lot of children miss school and have inferior academic performance secondary to oral pathologies, dental disease. So it's very important that primary teeth are being taken care of. Primary teeth diseases can also contribute to severe oral-facial infections, which can become life-threatening. We see it at the Brigham and Women's Hospital, we see it at Children's Hospital all the time. It is something that is commonplace. Oral health is a part of total health. When we talk about the mouth, when we deal with insurance companies, when we deal with the state, for some reason the mouth seems to be disassociated from the rest of the body. Your insurance, your medical insurance doesn't cover dental, which is kind of strange. I mean, how did the mouth somehow disappear from the rest of the body? The mouth isn't that far away from the brain, if you think about it. Okay? If you get an oral abscess, you're about 3 to 4 centimeters away to developing a brain abscess. Your facial vessels, the vessels in your face, they don't have valves. So blood can flow backwards and forward. So if you have a facial infection, it can very, very easily travel to the brain, causing a brain abscess. But for some reason, the medical insurances don't cover dental. And the state policies in terms of overall medical policies are disassociated from dental policy. So now we understand the importance of maintaining oral health, and in particular for children, the frequency and when's the first visit. We need to talk about where are they getting these bugs from. In Massachusetts, if our